Hello everyone and how are you? I'm Dai. Today what I'm going to discuss with you with a simple question in the U world in the cardiophysiology section. Okay, so let's start reading the case, understanding the concept and idea behind the question, and highlight the keywords to reach the correct answer and diagnosis. Okay, a 56-year-old man comes to the emergency department due to chest palpitations, and he feels that his heartbeat is fast and very irregular. So this patient complains from chest palpitations and heartbeat is fast and very irregular. So this patient is tachycardic from these sentences. The patient has no chest pain, shortness of breath, or redness. So I understand from this, then this patient is not ischemic, or this patient has no myocardial infarction or angina. Physical examination confirmed the presence of an irregular rhythm with a heart rate of 120. So I understand that this patient is arrhythmic. Yeah, because he have chest palpitations. His heartbeat is fast and very irregular, and also the physical findings confirm the presence of irregular rhythm. He is mostly arrhythmia. Have arrhythmia. Okay. So what is the cause of this arrhythmia? He hosted a party last night for his wife's birthday and consumed a large amount of alcohol. Okay, the patient normally drink only 2 to 3 times a year, so he is not a chronic. He is not chronic. You have to focus on every word in the case and highlight the keywords. Every word in the case, okay, because from every word he can include or exclude an answer. Okay. He is otherwise healthy and takes no medications. He takes no medications and he is healthy, so no past history of any illness. Which of the following ECG finding is most likely is this patient? So the keyword here is he has the chest palpitations, he feels his heartbeat is very irregular, have no chest pain, shortness of breath or deadness, presence of an irregular breath. Okay, and he consumed a lot of alcohol. Okay, and he is not chronic alcoholic. He drinks only 2 to 3 times a year, and no past history of medical illness. He has no medications. Okay, so what is the most probable diagnosis from the case and from the keywords? I guess in the possible diagnosis is atrial fibrillation. It's common in alcoholic. Okay, so what I found in the atrial fibrillation on the ECG, I find absent P wave, no P wave in the atrial fibrillation, no P wave in the atrial fibrillation, no P wave in the atrial fibrillation. Okay, so let's exclude and discuss the other answers. High voltage in precordial leads. High voltage in precordial leads. What does this mean? This means that this patient or high voltage in the precordial leads, it occurs in hypertrophic heart, and these patients have no history of hypertrophic heart because he has no history of hypertension or anything that makes the heart to be hypertrophied. So I exclude this answer. Then prolonged QRS complex. Prolonged QRS complex, it occurs in delayed conduction, and this patient is tachycardic. And in tachycardia or in atrial fibrillation, the QRS complex shortens, not prolonged anymore. Then prolonged QT interval. Prolonged QT interval, it occurs in torsades points and in chronic alcoholic users, not in acute. This patient only drank 2 to 3 times. He's not chronic. So I exclude that. And the last is the ST segment elevation. ST segment elevation, it occurs in myocardial infarction, and this patient have no sign of ischemic heart disease. this patient has no chest pain, no shortness of breath or deadness or anything like that, so he has no history of myocardial infarction or angina, so I exclude the ST segment elevation. So let's read the explanations together. Okay. This patient's presentation, palpitations, tachycardia, and irregular rest is suggestive of atrial fibrillation AF. The ECG in the patients with AF typically shows an absence of P waves and irregular rest with varying RR interval. Atrial fibrillation, absence of P waves, irregular rest in varying RR intervals. Atrial fibrillation, absence of P waves, irregular rest, varying RR intervals. Atrial fibrillation, absence of P waves, irregular rest, varying RR intervals. Okay, you have to keep this word into your mind. Keep it. Okay. Some patients have irregular low amplitude fine fibrillatory waves between the QRS complexes that represent the tragic atrial activation. AF is the most common tachyarrhythmia and is often precipitated by acute systemic illness or increased sympathetic tone. It is occasionally seen in patients after excessive alcohol consumption. Atrial fibrillation, absence of P waves, irregular rest, varying RR intervals. Holiday heart syndrome, systemic illness. Okay, that can be precipitated atrial fibrillation include long-standing hypertension, heart failure, and hyperthyroidism. And this patient has no history of any disease, so I exclude that. Choice B, the QRS voltage in the precordial lead is a sign of ventricular hypertrophy, which most commonly results from prolonged untreated hypertension. This patient has no history of hypertension. Although hypertension can cause atrial fibrillation, this patient has no history of long-standing hypertension, making his acute drinking more likely etiology. Okay, then choice C. The QRS complexes are narrow in atrial fibrillation. Prolongation of the QRS interval occurs as a result of delay in interventricular conduction due to vesicular or bundle branch block. The heart rhythm remains regular in patients with interventricular conduction abnormalities. Choice D. A prolonged QT interval can be congenital or acquired, and it is associated with an increased risk of torsade points, pleomorphic ventricular tachycardia, and sudden cardiac death. The QT interval can be prolonged with chronic heavy alcohol use. These patients all drain 2 to 3 times per year. He is not chronic. Okay, but this would be unlikely in a patient who drinks only a few times a year. Then choice E. ST segment elevation on an ECG is typically seen in patients with acute transmural myocardial infarction. In the absence of associated arrhythmia, the heart rhythm is typically regular. Okay, so I have to learn from this question these points, the educational objectives. Palpitations refer to a subjective sensation awareness of the heart rate or of the heartbeat due to rapid arrhythmia of forceful ventricular contractions. Then, atrial fibrillation is the most common cause of an irregular rhythm and is detected in the ECG by absence of the organized P waves in varying RR intervals. Thank you very much.